Thank you. Could you hear my voice clearly?
Yep.
Yeah.
Okay.
Yeah.
I will express my thoughts in narratives and perhaps not really specifically addressing each of the speakers, but try to be more elaborative. But first of all, allow me to congratulate the Center for Bioethics and Medical Humanities, and also more personally to Professor Sunarto and Professor Yati Sunarto and the team for the significant achievements up to the 20th anniversary this year. And the three speakers this afternoon have highlighted important aspects in life and to demonstrate how COVID-19 brought significant changes into our lives with specific challenges for hospital business, for public health, and also I'm amazed of Rimawan's initiatives to improve social capital. As an academician and also COVID-19 victim, I would like to start by stating that the pandemic certainly has brought very deep meaning and changes, very deep changes to human life, which for some, the changes could be positive, considered as positive, but for others, this can be very devastating, unrecovered. And I think at this stage, at least I feel that we face with many more questions than those that we are able to answer. So in this occasion, I think I might actually add some questions rather than discussing from all the three speakers. But I'm very sure that this pandemic has created also a lot of pressure for bioethicians, yeah, with all the situations we face. Now, for the hospital business, I think the situations we can call a crisis in standard of care. And by standard of care, it encompasses all the clinical and the managerial aspect. Today, it happens to be the World Patient Safety Day, September 17th. And the theme for this year really reflects one of the key challenges that we face in hospital business, that is health workers' safety, a priority in patient safety. We've seen that this has been an ongoing crisis in the health human resources. It didn't come in the beginning of the pandemic situation, but I think as the pandemic is ongoing, we face and we realize that this could be becoming one of the chronic crises in the health system. And this, of course, is in addition to all the urgent type of crisis experienced by the hospitals, lack of ventilator, ICU beds, safety equipment for all the staff and the health workers, all this acute. So we are in parallel, I think, facing all the acute as well as the chronic crisis in hospitals. I don't think so much of an ethical issue when Prof. Laksono mentioned that, you know, whether it's ethical for the hospital to sort of earn, you know, income through COVID-19 responses. Because I think it's as long as this is a good managerial practices, keeping within the how do you say normal way of doing business. But the ethical issue could be, I think one of the key ethical issues is inequity or fairness. In other words, for example, how can we resolve all the acute and chronic problems when we are receiving also waves of patients coming, flooding the hospitals, Plus, currently the health workers are getting perhaps weaker, are getting less in terms of numbers. And to an extent that this also impact the more of the vulnerable communities. Let's say, for example, if the hospital has very limited ICU beds, would they give it to a person with a high socioeconomic, or would they just use the current queuing system as it is, or what consideration do they have? And also, when the resource is limited, how can we judge which services not to give, and whether the responses is more of limiting the service rather than advocating for more resources using different channels. So I think the ethical issues is more on this. And if we are talking about the future, we always have high hopes to vaccine, which is a valid hope to have. But then let's say that the vaccine is available and it's effective, good for all, then we perhaps would face even a bigger question on fairness. How we provide this for all, more than 250 million people of Indonesia, and how we distribute them. My second discussion was more on the angle that this situation also reflects how fragmented it is between, we have the hospital system, we have the primary care system, and then we have also all the community initiatives to make sure that the community is resilient and also able to cope with all the situations like this. Yeah, perhaps this is a little bit too specific, but I think when it comes to clinical care, we realize also that resources have been perhaps allocated not evenly. When we talk about primary level of prevention, secondary and tertiary, and moreover, I think there's one more area which is which has a lot of heavy issues on bioethics, which is palliative care or end of life care. And with all issues of ventilators, ICU beds, I think this really give a motivation for all of us. Perhaps we should look more into this. And this is an area that, with or without the pandemic, I think, including in Indonesia and perhaps several other countries, this is an area for us to strengthen also. So I will not speak very long. Pusivi is already quite nervous. So let me say that when I saw these three speakers, Prof. Laksono, Pak Doni, and also Prof. Rimawan, I imagined that if we could connect this, three speakers in real life, we have the hospital system in place, we have the public health surveillance, and Pak Doni is doing all the tracing and then also we have the community being very resilient, strong with all the initiatives, like the beautiful example of Pak Rimawan. I think this is an example that we need, how we remove all the barriers, all the disconnections between the person, the family, and the health system. And I do believe a lot of discussions, a lot of contribution of the bioethicians will really help to address the critical challenges to achieve better fairness of the health system. Thank you, Sivi, and thank you to all the participants.